We are also hearing about a bigger problem than the website tonight. A new report says the vast majority of people signing up on these state-run exchanges, because you got the federal exchange and then you got the state ones, and that's where most of the action's been on the states, because those work. But most of the people signing up for those now are not paying any premiums. Instead, they're signing on to Medicaid. That's coverage for low-income families. It costs the people signing up nothing. If this keeps up, it is hard to see how the system doesn't fall way short of the money it needs. They need the people who are actually going to buy policies to sign up on these exchanges. They're not getting them. Betsy McCaughey is the former Lieutenant Governor of New York State and author of Beating Obamacare. Betsy, this is a real problem.
But it's not a surprise, Megan, because this law, as written, is designed to vastly expand Medicaid and pay for it by eviscerating Medicare, taking $700 billion out of Medicare and moving it over to fund this expansion of this entitlement. It's like robbing grandma to spread the wealth.
Why would they want to vastly expand Medicaid?
Because they believe in a single-payer system, and Medicaid is a single-payer system. This is a way of vastly shifting resources in this country from one group of people, the elderly, to another group of people.
So you think this is by design? I mean, we're getting reports.
I've read the law. There's no question that it was by design. And in fact, it would have been twice as big, but the United States Supreme Court ruled a year and a half ago that states couldn't be forced to expand Medicaid.
Right. So now
only half of them have done it.
Didn't do it, basically, and the democratically controlled.
Largely, that's true. That's right. And some of the states were very smart. They realized that even though the federal government says it's going to pay 100% the first couple of years and then 90% thereafter,
of the Medicaid
politicians always break their promises. And when that happens, they'll pull the rug out from under these states, and the states, which already spend about 24% of their budget on Medicaid, will have such huge costs, there'll be no money left for schools or roads or law enforcement.
That's the question, because we're hugely expanding Medicaid rolls right now, day by day, as we sit here with no way to fund it. So who winds up footing that bill?
The elderly. That's what happens under this law. $716 billion is taken out of Medicare and shifted over to Medicaid. A lot of it is across-the-board cuts to hospitals, but one section of this law, Section 3000A, awards bonus points to the hospitals that spend the least per senior, not the least per patient, the least per senior. I wouldn't even take my beloved dog to the vet that spent the least per animal. Why would I take my mother to the hospital that spends the least per senior?
I need to ask you, because coming up in 20 minutes here, Emanuel is going to join us. This is the brother of Rahm Emanuel, and he is said to be the architect of Obamacare. He's a respected doctor, but he's been under a lot of fire since this law was born. Because
and his values are very much reflected in here.
His handprints are all over that, and
That's
we're going to talk to him. And I am going to ask him, and I'll tell you right now, that's what I'm going to ask him. Was the president misleading when he said we could keep our doctors and we can keep our plans intentionally, or was he just grossly mistaken? Because it's clear now that hundreds of thousands, if not millions of Americans are not able to keep their plans and not able to keep their doctors. What do you want to know from Emanuel? I know you've been a critic.
Well, first of all, it's not what I want to know from him because I've read his writings very thoroughly. But his values, I believe, are dangerous, and most Americans would agree with me. For example, in his 2008 article in the Journal of the American Medical Association, he says that doctors in America take the Hippocratic Oath too seriously and focus too much on the needs of their own patients. They ought to be thinking about whether the resources could be better used for the teenage mother down the hall or some other patient. You know, when you're in that exam room on that table, you want your doctor to be focused only on what he or she can do for you.
I'm going to ask him about that and many other things.
And he says 65-year-olds? They've had their chance.
I will ask him about that and give him the chance to respond in an important interview that's coming up. Betsy, thank you.